Hello everyone. Today we'll speak about Gierke's disease. So Gierke disease is a type of glycogen storage disease. It will happen because of a deficiency in the enzyme glucose 6 phosphatase, which is essential for the final steps in both glycogenolysis and gluconeogenesis. So what will happen? We will have a glycogen in our body. We need to convert it to glucose so we can use it as a ATP form. So we will need glucose 6 phosphate to do that. But this is not here, so we can't do this. So we will have a glycogen accumulation in our body. So this will lead to a couple of things. First of all, hypoglycemia because we are not getting the glucose, so we will have low blood sugar in our body. We'll have a lactic acidosis due to the accumulation of pyruvate and lactate. Hyperuricemia, elevated uric acid levels, and which could lead to gout, which is a rheumatological disease. Hyperlipidemia, because we'll have an increased blood lipids as an alternative energy source, because we can't use glycogen as an energy source. Clinical features, we will have a hepatomegaly, a severe hypoglycemia, growth retardation, doll-like face will appear, and we will have some renal involvement, like enlarged kidneys, and then sometimes bleeding. So this is the doll-like face, as we can see. This is we can see that abdomen is enlarged because of the hepatosplenomegaly. So this is again doll-like face. Hypoglycemia could lead to seizures or coma, intellectual disability, and the glycogen accumulation will lead to kidney enlargement, hepatomegaly, and descended abdomen. So for the diagnosis, we'll have a low blood glucose levels, elevated lactate, uric acid, and triglycerides. Liver function test may be no abnormal, or so it's not a confirmative thing. Enzyme assay, we will search for glucose 6 phosphate activity in the liver biopsy sample, and we will see how it's functioning. We will also do a genetic testing in the G6PC gene to see if there's any mutations. For the management and treatment, so first of all, we do a dietary therapy, frequent feeding, and continuous overnight gastric infusions to maintain a blood glucose level because this will lead to retardation and seizures. Use of uncooked cornstarch as a slow release form of glucose. Managing metabolic abnormalities, like we can give for the hyperuricemia, allopurinol, and we can give statins to lower the lipids in the body because we said that we will have it high because we will use it as an alternative source of energy. And for the long-term care, we should always monitor our like parameters, the glucose level in the body, the uric acid levels, the lipid levels, and liver transplantation could be considered in severe cases. For the prognosis, with early diagnosis and strict dietary management, patients can live like a normal life with no other thing, but complications like adenomas and renal disease could be occur later in life. That's actually everything. Thank you so much for watching. I hope you found this lecture useful. That's all. Have a great day. Goodbye.